There are a lot of brokers who are getting paid a lot of money, and a lot of HR people that have no idea how much money they're getting paid. As an HR person, if HR people don't get involved in this, benefits is going to end up as a function that exists within finance, not within HR.
Hello, everyone, and welcome to another edition of Break the Wheel. I'm your host, David Murray, here with Chris Cigarran, a former CHRO and the Chief Commercial Officer at Imagine 360. Chris, great to have you today.
Dave, it's great to be here. Thanks for having me.
Awesome. Well, we're going to dive right in because I just got back from a vacation. I was on a Alaska cruise with my mom and my partner. Yeah, it was fun. So what better way to end a vacation to still have something else to drink with wine?
I want to hear all about
it. I'll tell you about it afterwards. How's that?
All right, perfect.
So today's wine, we're going to uncork and unwind. It's from England. And speaking of England, and actually, let's do a little cheers. Are you drinking anything special by any chance?
I have my non-alcoholic, just in case, athletic beer, which is my favorite. A little plug for athletic beer.
Oh, that's nice. I never heard of it before. I'll have to try it out.
Delicious.
Awesome. Do you feel more athletic after you have it?
I don't.
Well, I can tell you, I definitely don't feel athletic after, watching whales for the last week and a half. But I'm like, I feel like the whale after. Anyway. Diving in, uncorking, unwinding. So yes, today's wine is from England. And speaking of England, the UK government has unveiled a groundbreaking £64 million scheme dubbed WorkWell. And it's aimed at supporting individuals with health conditions. It'll help employees decide to either stay in or reintegrate into the workforce. It's set to launch this October, and this initiative will link an estimated 59,000 individuals with vital local services such as physiotherapy and counseling. The ultimate objective is to curtail the number of individuals exiting the workforce due to health-related reasons, thereby fostering a more inclusive and resilient labor market. Let's dive in with your thoughts on that, and then we'll give more context on your background.
I think all these things, the intention is awesome, right? You have all these people who, if they were, whether it's physical health, emotional health, mental health, who could be working, who aren't able to work, and to create a program to help them re-enter the workforce, I think is pretty cool. The hard part is always in the execution, and how do you engage with these people and really meet them where they are, and create a program that's actually going to get them back. With unemployment as low as it is and people leaving the workforce, it's a critical problem. I'll be curious to see how it works, but it seems to be met with some pretty good fanfare at this point, and so we'll see.
That's awesome. Well, I love that, not only do you have the background, obviously, as a chief commercial officer, but the former CHRO background, I think, is fascinating. And my understanding is that you oversaw more than 3,000 employees of a publicly traded company. I can imagine that gives a unique set of perspectives and insights onto some of these matters, huh?
Yes. We started as a small company and grew into a big company. And I always say the bigger you get, especially when you sit in the HR seat, the end of the bell curve gets bigger and bigger, and the stories get stranger and stranger. So it was a wonderful experience. I loved my time as the head of HR, and it was wonderful. And I learned a lot, and it's a really hard job.
That I think every one of our listeners would agree with 1,000-fold. Hard job, understaffed, under-resourced, and underappreciated. So it's
Amen.
Yeah.
Agree wholeheartedly.
Awesome. All right, moving on, we're going to jump into the HR news flash. So after a survey conducted by Anthea provided 67% of patients saw an improvement in depressive disorders and 65% felt better in dealing with their anxiety, U.S. employers are beginning to offer ketamine therapy as part of standardized benefits. For our listeners who don't know what ketamine therapy is for, it's a therapy used to treat depression, anxiety, PTSD, end-of-life distress, chronic pain, drug, alcohol problems, and more. Now, I personally actually have some personal familiarity with it, but I will hold that until I first get your thoughts. What do you think about this new treatment and it being part of a standardized benefits plan?
So first of all, work in healthcare and have for 23 years, but I am not a doctor. And so I'm the last person that you should be getting advice on, whether or not this therapy, works or not. That being said, I think the whole mental health field is really just getting going. It's trailed behind every other kind of ailment for years. And so I'm not surprised to see this come to the forefront. And, I think as long as the right people are looking at it, then it's something that should be explored. And, as an HR person, you talk to medical professionals and doctors and get lots of opinions before you put something like this in. But, I think breakthroughs in mental health are really important.
100%. Well, I would say that's a very well articulated and political response that you're not a doctor, but I will say, as somebody I've actually done this treatment before, and it was incredibly effective for me. I'm somebody who's incredibly high anxiety, and for anxiety, it was really awesome. Typically needs to be given as a secondary treatment once you've tried something first. But man, so many newer experimental, treatments out there that can be really, really painful to get covered by insurance. And I think probably it's one thing that we all share, at least in the US, is the nightmare of dealing with insurance. And even if insurance is awesome and it's run by an awesome organization, people struggle, right? I think we all do. Even I worked in healthcare for 6 years myself, and it's tough to work for an industry that has problems, but it's good to try and be part of the solution. Yeah.
Yes. Yeah. I've again spent a long time doing this, and to your point, insurance, we call it lots of different things, right? Health insurance, what the carriers do, and I'm not sure what they're carrying. It costs out of a lot of money, but we exist as an organization because we believe the system is fundamentally broken and is really failing the average American worker and the employer. And we're just trying to help employers and employees take back control of healthcare and make it affordable. It's something that we're really passionate about. We're trying to do it differently. We think that the people who are responsible for it now are not doing a very good job. And if you think about, I always think about the average person who's making $45,000 a year and has a $6,000 family deductible, and they go and get care in January, and say their kid breaks their arm and they end up in the emergency room. They get a $3,000 bill from the hospital. They're ended up in collections. They're ending up with bad debt. They're ended up with credit impairments, and that's what the current system that we love so much creates. So I think we are so far past the time to try new and different things. As back to how we started, as HR people, I think it's really important to marinate in how bad the current system is from an insurance perspective. And I think when people actually think about their average employee and what that experience they have in not being able to afford to go to the doctor or the hospital, they will realize that there's a huge need for change now. And that's what we're out there trying to do, and really proud of our solution. We say that we're on the right side of healthcare. It's something we're proud of.
Well, that's the great transition into the reality check. So I'd love to hear more and to learn more, in particular because, again, we have a lot of CHROs, chief people officers, and other senior HR leaders that listen to our podcast. I'm curious to hear your perspective in terms of the daily realities that many of them sit in today, and some of the struggles. I know some of them have PEOs, some of them do their own thing, some of them, everyone's kind of doing something different. But given that you've been kind of living and breathing this world, I'd love to hear, a slice of your reality and maybe some perspectives that they may find valuable.
Yeah, no, so that's great. And so I'll stay on the healthcare side. We can talk about lots of different things, but I'll stay on the healthcare side. I think generally, when an employer gets big enough to be self-insured, and it used to be you had to have 1,000 employees, and now it's down to 100, and in some cases under 100, and that obviously just means the employer's taking the risk, and so the payer or the health insurance company is not an insurance company in that case. All they're doing is administering claims and answering telephone calls after being on hold for 20 minutes and being in voicemail, right? So they're not actually doing a whole lot. That the employer bears the burden of the insurance. It's really important to understand as an HR person what the heck is going on. And a lot of times, and I did this when I was running HR, I don't want to use the word abdicate, but I guess I just did. You abdicate responsibility to your consultant or your broker, and whatever they say goes. I think that's a problem. There are lots of great brokers out there, lots of great consultants. I was lucky enough to have one, but you have to be in the weeds. And a lot of heads of HR didn't grow up in the benefit space and aren't necessarily math people. And And that can become an issue, because if you don't know how it works, if you don't understand the math, if you don't understand simple things like, how much am I paying my broker? Right? There are a lot of brokers who are getting paid a lot of money, and a lot of HR people that have no idea how much money they're getting paid. Do I understand what's actually going on within my health plan? Is my broker bringing me alternative solutions outside of the traditional Blue Cross, United, Cigna, and Aetna? Are they just bringing me point solutions, and do those point solutions actually work? I mean, I could go on, but I think the bottom line is it's a second or third biggest line item within an employer. Within an employer, HR is responsible for it. And if you're not spending a ton of time understanding what's going on within that function, within your health benefits, you better be. Because if you're not, and we've seen this with in the industry really over the past couple of years, more and more the CFO is getting engaged. And I think, again, as an HR person, if HR people don't get involved in this, benefits is going to end up as a function that exists within finance, not within HR. And that I think would be a shame.
That's it certainly resonates. I recall, at the last company that I was a part of that had taken on a little bit of the burden of the benefits, like the sticker shock of some of the costs and the changes and the deltas year over year that you just completely don't expect. And suddenly you need to start changing critical budget line items because, someone had, for example, some major medical thing come up and, you just didn't catch wind of it in time, or who knows what,
Right. Yeah. When you're taking the risk, you're taking the risk. Right. And there can be some big claims come in. And part of that is, right, again, if you get in the weeds, and not that it's fun, it's kind of interesting, but if you get in the weeds and you understand it, and then you start looking at, just look at your I look at the bills that come from the hospital in a much different way than I would have 10 years ago. Right. And you look at what comes across, and some of it is nuts, right? Some of the stuff that the insurance company lets pass through from a hospital is absolutely crazy. And again, we've let it go on for too long. It's time for us to do something different, but it starts by engaging differently in terms of how we're making decisions about healthcare. And again, right, last piece, I get pumped up about this, as you can tell, right? We have a fiduciary responsibility under ERISA as HR people to be making decisions with care, skill, and prudence. And if you think about trend over the past, 20 years, 5 to 10% this year, I'm not sure that would qualify as making really good decisions under ERISA. And so I think there's a legal risk as well for us as HR people that we need to think about.
Well, I understand that more than 900 businesses now administer, the Imagine 360 plan, a different kind of employee health plan and benefit solution, which I think is fascinating. So probably a great transition to maybe ask around what people misunderstand. What do people misunderstand about this solution, this opportunity, or even your space or something that you see every day?
So that's great. So at a high level, maybe you're just talking about, so we come in and we replace the traditional carrier plan, supported by Blue Cross, United, Cigna, or Aetna. And we have all of we have what's called a third-party administrator, so we can administer claims and send out ID cards. And we actually a real human being answers the phone in under 35 seconds, which is not how it normally works in healthcare. The person is not paid to get off the phone, really quickly and then get to the next call. They're actually paid to care about our members. We say nobody chooses to engage in the healthcare system, right? People aren't like, hey, today I want to go to the hospital, right? And when they do, they're lost, they're scared, and they're not happy, and they're confused, and it's hard to remember stuff. And so calling in and having an empathetic person answer the phone and really care is really important, and that's what we offer. The other piece that really differentiates us is how we pay claims. And so what that means is how we pay the bills, right? How we pay bills is different. And we do that in one of two ways. We have contracts with really high quality health systems across the country. And in exchange for an exclusive relationship, those partners have given us rates that are below market, right? So our employees and their employers save money. When one of our members goes to a health system that is not one of those partners, we pay using what's called reference-based pricing, which is basically we use a couple different metrics to pay a fair price for the care that our members receive. And the culmination of that is from both a member perspective and an employer perspective. And we just did a big release just probably 2 weeks ago on this. We're saving our employers and their employees on average 20% off the standard solution. And again, back to it being the second or third largest line item within an employer's budget, 20% is a lot of money. And we do that in the first year, and it's not soft savings, it's real savings. And so that's why we've got 900 clients and growing. We've become now a sizable organization. We're the market leader, and we really believe that we're just getting started. So it's kind of exciting.
That's awesome. When folks, I was mentioning that I was going to be having you on the show, and folks were like, why would you have someone kind of the benefits world when, what Confirm does is really focused on like performance management, on reinventing how people are recognized for the difference that they make at work. And I think the reason is, well, a couple of reasons. I mean, one is just having been in healthcare and knowing like CHROs, this is a thing that I think we all, like you mentioned, nobody seeks to spend their time or their energy, dealing with any of this, right? But it's a necessity, right? It's an important necessity. And I think that's something that, benefits and insurance have in common with performance management, performance reviews, and some of the like is that there are some of these things that, pretty much nobody at an organization is necessarily excited to do, but it's critical to eat your vegetables, no puns intended, to be able to function and to have a thriving workforce so that they can, get their healthcare issues taken care of, get their, in our case, performance issues taken care of so that they can, contribute meaningfully. So that resonates, and it's cool. It's cool to see alternative solutions. This is another thing. Like we're Confirm is an alternative solution in a space that's been kind of the same for like 10, 20, 30 years. And so I love talking with other folks that have interesting, unique, and alternative solutions to, the same way of doing things year in and year out. So right. how I mean, with the group that you have, I'm kind of curious, like that transition, that shift from, being used to the Uniteds and the Aetnas and the yada, yada, yada to this new plan. What do you think are the key things that, I guess, that maybe they find as surprising once they make this switch, or maybe even most challenging when they make the switch, or maybe even, unexpected, when they make this switch?
Fabulous question. So, yeah, I think at first we've got to have the HR team and the executive team excited about the change, right? And on board, because communication in the first quarter, right? Starting an open enrollment, as we all know, but then really in the first quarter is really important. And we'll go on site and do open enrollment meetings. We'll do virtual meetings. We do it any way that an employer will let us do it. And we'll do it during an open enrollment, we are all over the country doing education sessions for employees, direct face-to-face, or however we need to do it. I think the biggest surprise is probably twofold. First is how well it works, which is a good surprise. And then the second piece is once they get into the second year, sort of how smooth things go. It's not, right, any health plan, there are always going to be issues. There's going to be people who have questions. There are going to be people who have complaints. I mean, very rare, I joke, right? Again, being an HR person, no one ever calls HR and it's like, hey, I just want to tell you how awesome the comp plan is, or the performance management system is, or the benefits are, right? It's like, it's just not how it works. It's not what you sign up for. But at the end of the day, our goal is to create a plan that the organization and the HR team can be proud of, and that's going to return money back to the organization, back into the employee's pocket, so they don't end up in collections and with bad debt and all those different things. And right to your earlier point, why would you have me on here? Well, guess what? If we save an employer 20%, then they're going to have money to invest in things like a new performance management system that otherwise they may have, in an Excel workbook.
Right. Pretty common actually still these days. So yeah.
Hey, I've been there a long, long time ago.
Awesome. Well, again, exciting to have this new innovative approach out there in the world, and excited to have you sharing about it. So with that, let's jump into a little bit of fun with our break the wheel or break a heel segment. And unsurprisingly, the topic is employer covered healthcare benefits. So with each of these, I'm gonna share the item, and you're gonna tell me whether you think it breaks the wheel, meaning good, awesome, or break a heel, which, you know, I maybe not all of this here are familiar with what it feels like to wear heels. I will say I did. People may not know. I was in gosh, I don't know, 9th grade, 10th grade, something rather, my high school something. We had the Fisher King, and I was the gay bum, so I dressed in full drag on stage now. So yeah, heels are hard.
I love it. I love it.
So
as well. I have as well. It's
there
Halloween.
you go.
I'm
Halloween,
there.
yeah, awesome. All right, well then break a heel. You know what it feels like. So break a wheel or break a heel. Diving in first, gyms and wellness centers. Break the wheel or break a heel.
I think break a wheel, and I think you got to be careful about not just paying. The culture, the worried well, right? You have the people who are so healthy already, and you don't give those benefits just to have people who are already going to the gym to pay for them, right? You want the people who really need it, who aren't going to go. And so you have to engage people to get into the gym if you're going to pay for gym benefits. But I think they're great, and I've seen it done before and seen it be really effective.
Awesome. There was a startup, I don't know, 10 or 12 years ago that was in a similar, I was in a healthcare tech accelerator, and they were doing basically like benefits, but you could go, you could run a lap around your house or something and record it, and then it'll show up with as a benefit, or you get some kind of kickback or something.
Yes.
So I think it's cool to see that there's still interest in that space. All right, next, biometric screenings. Break the wheel or break a heel?
I'll be a little controversial on this one. Break a heel. I used to sell this stuff, and I think it's really how often. So they're generally done every year, and it's really, depending on the age of the population, it's too much, and it can actually increase costs. And so I think if you get a little more sophisticated about it and do it sort of based on age bands when the people actually really need to know, and then do it temporally, so how often, they can be really effective, but you don't need to pay everybody $200 a year to go get a blood and biometric screening done. It's overkill.
Interesting. It's bold. It's bold to share that. Only that, I mean, it totally makes sense, right? I think you hear, you come into the physicians and you say, hey, my friend said they did XYZ test. I want to get XYZ tests. And they say, you don't need XYZ tests. Stop asking for XYZ tests. I actually had this for, I don't even remember. I had a friend that he was in China as an expat, and they just tested for everything under the sun, because they have a healthcare system that looks a little different than ours, and but from that test, he discovered that he had a thyroid issue that he didn't know about, and so then it made me go, oh, I wonder if that's related to my anxiety, and I want to go to my doctor, and I'm like, I want a thyroid test too, and it's like, well, one of the surprises that I learned actually, as it relates to testing, is when you get tested for food allergies. So my mom, she tested 10 years ago and got tested positive for a bajillion different food allergies. And then after that, every restaurant she goes to, she says, I can't have this, I can't have that, I can't have that. And so I was curious to get this test myself. And I read online that at the time it was there's a very high false positive rate. And in some of these tests, it's 30, 40, 50, 60% false positive rates, where you really don't have this food allergy, but you think that you do because you react, and in reality it's some other thing. Now,
that's right.
I'm not a doctor, as I'm sure you can tell, so I'm not. But it goes to show that the recommendations are there for a reason. My mom asked me, when are you getting your colonoscopy? When are you going? I was like, it's 45 is the age, Mom. I still have 5 years, so no rush.
Yes.
I don't know how many moms ask their children about when they're getting their colonoscopy, but anyway.
More and more so lately. I think it's important. Yeah, it's important. Well, and you've got a good doctor if he's saying no, right? That's right. You've got a good doc.
And save the resources for those that truly need it. Those that show risk factors, and those that So I think it's bold to say, but what you share resonates. So, all right, moving on. Number 3, fertility. Break the wheel or break a heel?
Break the wheel. I think also it depends on the employer, right? Some employers can afford it. and some employers just can't. And so, but I think, right, it's an important benefit to offer. And I think you also have to juxtapose that with the reality of the overall benefits package and the expense related to the benefits package. And so, again, if an employer is struggling just to provide basic coverage to get people healthcare, that's going to be a different set of criteria than Google, right, and their benefits package. And so, again, there's the reality of cost that comes into all these decisions, and that's part of what makes the HR job and the benefits job hard. But I think overall, right, it's obviously a necessary benefit, and I know I've had friends go through it successfully, and I'm not sure it's one of the more stressful things that people go through, and having the organization's support in that journey is really important.
Sure. And, even if you can't afford, for example, fertility, I mean, just supporting, reasonable paternity leave or maternity leave policies, parental leave policies that allow you to have the time and the space that you need. I mean, that's a great place to start. Yeah.
Totally agree.
Awesome. All right. Number 4, health-related cannabis. I know. Well, we didn't make them easy for a reason. Got to entertain somehow. All right. Health-related cannabis use. Break the wheel or break the heel.
Oh my gosh, you're trying to get me in trouble. So break the wheel, right? I think the science is pretty clear on this now. I would say, again, just having traveled around to all the states, there's the recreational use, right? And then there's the medical use. And when you're getting into the plan design and support of this, is hard. This is hard stuff for an HR person. It's hard stuff for a company. And so again, not simple, and also, like, for cancer patients for a really long time, whatever we want to call it, marijuana has been a part of the treatment and an important part of the treatment. So again, I got my beer here, actually my non-alcoholic. But yeah, I think break the wheel.
So when we were in Alaska, there was, I think, whatever cannabis dispensary at one of these places or whatever. I think, Alaska has more liberal laws about this. And I was talking with my mom, and, she's like, wow, so many places now have legalized marijuana. And I said, yeah. And what I said, and I truly believe this, is I think that alcohol has probably wreaked more damage in the world than marijuana has. So, for what it's worth. But
I think the piece, right, as someone with two teenagers, like a 20-something-year-old and a teenager, I worry about the way again, I sound like an old person. I guess I am. The way it used to be, right? The pot when I was growing up versus the pot now, it's like two different animals. And so I think there's something in that as well. But it's like everything. It's complicated, and I think you just got to be thoughtful about it.
Yeah. Well, one of the benefits, I guess, is when money can be made and there's some kind of regulation involved, that you can at least rely that you're not going to have something crazy laced in there. So that's fair. All right. Number 5, break the wheel or break the heel. Weight loss counseling.
Oh, break the wheel all day long, right? I mean, it's been happening for a long time. It's critically important. I think what's happening now, and I'm sure you've probably talked about this before, on your podcast, GLP-1s are sort of taking over by storm, and they're also blowing up companies' budgets. $1,000 a month per person is a lot of money for a GLP-1. And so a lot of employers got caught off guard, right, by GLP-1s coming out. And now a lot of them are mandating sort of weight loss coaching first before you get, or at least with, a GLP-1. And so again, it almost gets back to our earlier conversation in terms of, therapy plus, which is probably the best combination. But I think, weight loss coaching done effectively by the right organization, so long as people are engaging, is a no-brainer. I really do. It's really important, especially given the obesity epidemic that we have in the country.
Absolutely resonates with me. Well, also reminds me of a song I listened to a year ago called Ozempic, Wegovy, Mounjaro, No More Sorrow by Ari. So, but yes. Yeah, I listen my Spotify, just random discovery, and I listen to that on repeat. I'll say just because it's catchy and it's ridiculous. So yeah, you want something crazy to listen to. Who knows what else I've been listening to that causes that. All right, well, we got through the break the wheel or break a heel. I think you did very good. Actually, when I looked at this list ahead of time, I thought this might be a challenge, but you made it through. You made it through really well, and boldly. I'll say boldly. Yeah, I appreciate your perspectives there. All right, moving on to the wheel breaker of the week. So, though still on the margins of the labor market, the concept of green perks is being added to compensation packages and employee benefits. Commuting benefits are an example, and companies including Beam have cycle to work schemes where they are reimbursing employees for purchasing commuter bikes and investing in e-bike chargers, bicycle racks, and showers for workers working up a sweat on the way into the office. Thoughts on that?
I think this is going to be so employer dependent, so location dependent. Again, if you can afford to do it, if it works in your geographic area, I used to ride my bike to work when I could. I think great, but I think it's going to be hard to do. I don't know how many people are commuting to work anymore anyway.
I do about a seven step commute, from in there.
Me too. I think it's interesting, but it's probably not going to, sort of take the world by storm.
That's fair. I talk a lot about return to office on this podcast just because it just continues to be a really hot topic. And I follow Stanford professor Nick Bloom, who's like one of the key folks that's always on everywhere, basically talking about return to office. And the latest stuff that he shared in the last few weeks shows that over the past 6 months or so that things have leveled off. Like it used to be return to office, and now things are leveled off. About a third of us are working from home, and that's not really changing much at all. So, whether you have a 7-mile commute or a 7-foot commute, we're all making it work somehow. So awesome.
I totally agree. And it's given us a lot of freedom.
Absolutely. Awesome. All right. Well, with that, I'm going to jump into one of my more favorite segments. What should I have done? So I was thinking, yes, what is relevant to your world, and thinking about this, I thought, what should I have done? Well, I'll share with you what I did and what happened, and then ask you what I should have done. So in this case, this is actually related to Confirm. So in our early days when we were smaller, we had one PEO with one set of health coverage, and we realized we were kind of leveling up and needed to make a switch. So we switched to a different PEO, and what we found was that our old PEO failed to properly shut down our previous health insurance, set up benefits, yada, yada, yada. And so I personally had duplicate coverage on my health insurance. And so every time that I called in, basically I got rejected and did this whole runaround thing. And it was like a nightmare for months. And I just called and like, tons and tons of back and forth. It was mentally exhausting, emotionally exhausting, dealing with claims, because I had some medical stuff going on that year, was like just as exhausting as can be. And I just got completely fatigued and stuck, and didn't really know what to do. So what should I have done?
Did you raise what with the original PEO company?
Did I raise what? Oh, like as in did I throw my Diva card and make
exactly.
a fit? Here, you tell me what you would do, and then I'll tell you what I did.
Yeah, I would have. I mean, the PEO that took over should have made sure that didn't happen, and the PEO that was being taken over for should have made that. I mean, so they're both at fault. So I probably would have had a very difficult conversation with both of them, and maybe even, if they weren't going to make it right, found a third.
Interesting.
Because that's that's why you hire them, right? You're not doing it yourself because it's too complicated, and you're bringing them in as the expert.
Exactly right. Well, I fair enough. I ended up raising a little bit of hell with the first one, and thinking that maybe it was, at the time I thought it was more at fault of the first one to terminate, but didn't even think that the second one should somehow check or investigate or get involved in some way. But it absolutely makes sense. So Well, it's great that both are going unnamed, because I'll say that I was disappointed in both and I was frustrated by both.
I think that's fair.
Yeah. And it's what's interesting is at least when making a PO switch, certainly if you're like a smaller organization and your options are limited, sometimes you make a decision about which PEO to go to purely based off of health insurance and like what's covered and what's included, so that you minimize your folks on your team shifting from just being covered still.
Yeah, absolutely.
What a nightmare. Okay, fair enough.
Oh, that's hard. That is hard. That's a new one. I hadn't heard that happen.
Yeah, no, I was yeah, it was disappointing. But moving on. Yeah, I got through it. So how about you? Do you have a horror story of the week or any kind of real life HR horror story or
I have so many. One that jumps to mind, we had call centers all over the country, and one of our team members in HR printed the payroll, like the comp information for everyone in the call center onto the printer, and then forgot that this person had printed it to the printer.
Awkward.
So you talk about pay transparency. The pay transparency happened pretty fast.
Maybe it's just an innovator unknowingly.
Unknowing
innovator.
We were way before our time.
Yeah. Wow.
Yeah, that was one that created a little bit of anxiety.
So how did that resolve? I mean, then did everybody just know, or did someone like try and get it hush hush fast enough, or like what changed? I'm so curious. Or did the person just get fired?
No, they didn't get fired. They, I think they were absolutely humiliated and embarrassed, and felt terrible about it. And again, it wasn't a punitive culture, so it was like, hey, that's one that you're never going to let happen again, clearly. And I think it was at a time where comp was so hush hush that it didn't bubble up. I'm sure it spread, right? Of course, like such a fun thing to talk about, but it never bubbled up like it probably would today if it happened.
Interesting.
I think we thought it was going to be a much bigger deal than it ended up being.
Absolutely. It's interesting how I find this actually to be true with transparency in many contexts, that folks are way more paranoid about like what are people going to think when certain things are known, and oftentimes you just find that people knowing there tends to be a lot less drama.
It's so
than
much
the opposite.
Better. Yeah, I always say it's like if I just tell the truth, there's much less to remember. And so I think that goes for just being transparent, getting bad news out quickly. I just 50 examples of where it's a better way to be.
Absolutely.
Treat people like adults, right? They can handle it. Exactly. They're not children.
Exactly.
And if they can't, then they're probably not the right people anyway. And so that's definitely something that I've sort of lived by.
Yeah, that resonates with me. Awesome. Moving on, the wobbly wheel of the week. This week, it's Amazon, surprisingly. The Amazon CEO, Andy Jassy, had a lot to say about his employees' efforts to unionize in 2022. But those comments made casually to media outlets violated federal labor laws, a National Labor Relations Board judge ruled this week. The judge said Amazon should be forced to post a notice informing employees of their rights and committing to not threaten them. Amazon is appealing the decision. Thoughts on that?
Someone told me a long time ago that the companies that get unions deserve them. And I think this issue is always very gray. I think it's easy to say that, but then I think the truth is probably somewhere in between the two. I remember being an HR person, and we bought a company, and in between Christmas and New Year's, when we were all out, I got to fly. I got a call that the company we had just bought was starting to unionize. And so I was running HR, so I got to get on a plane. I was in New York at the time and flew to the office and just started meeting with people to understand what was going on. And as I went through one-on-ones with the individual staff members in the office, I mean, people were crying because they were so scared of coming to work every day. I think for when it's like that, then right, how can you blame them? And we ended up taking care of the people doing the right thing, and it went away. But we did it from a place of caring and understanding, not how do we root it out. And so I think it's about intention. I think it's about creating a place where people can do their best work, taking care of your employees, doing the right thing. And I think when you do all those things, you should be okay. So
that resonates.
I think that's what it comes down to.
Yeah. And it's, wherever your company is, however big it is, I mean, we all take on different problems at different times and need different solutions at different times. So wise words, I'd say. All right. Jumping on to water cooler whispers. This one I'm particularly curious about you actually knowing, this world of benefits and insurance and healthcare and the nightmare that many of us sometimes live in. Like, I'm curious, I always want to hear if there's any water cooler whispers of change that we hear, any word on the street of change or improvement or anything. Is there anything that you've heard that can maybe give us a little bit of hope?
Outside of what we're doing? I think we're bringing hope, right? I mean, we're coming hard and fast with hope in the healthcare space, and we really are. And we've got a great team. We've got some awesome results, and we're growing like we need to. And so I'm very optimistic. I think in the healthcare space, there are a handful of great companies out there doing the right thing, being courageous to go after sort of the big insurance companies, which is not for the faint of heart, because they're some of the biggest countries, not just in the country, but in the world, and some of the most profitable. And to take them on takes a lot of courage. But I think in the healthcare space, if our HR sort of friends are willing to take a risk and give people a chance and do something a little bit different, I think we can make a big difference here in the next 5 years in healthcare.
Absolutely.
So I'm an eternal optimist.
Awesome. Love it. Great. All right. Next, moving on to HR Speak Funny. So this one is interesting. I mean, it makes sense, I guess, as I read it. Tethered nomading. So this is the concept of a unique lifestyle for remote workers who choose to confine their professional journeys to the United States. This approach allows individuals to work from various locations across the country while staying within domestic boundaries. It offers the flexibility to explore different cities and regions in the U.S., creating a dynamic and nomadic work environment. Do you have folks at work that identify as tethered nomads?
I don't think I've heard that expression until right now, but I mean, I would tell you for probably 20 years, I've had at least one person on my team who has been somewhere around the country. And so I got comfortable with this a really long time ago. And I think it's awesome. It gives people freedom to do the right thing and be where they need to be. It allows you to hire people not just in one little city, but across the country. And so I think you're able to get better people. And, I think, and again, it depends on the type of work, right? But for the work that we do in healthcare and the services business, it just makes a ton of sense. And I'm not worried. All I care about is you getting your work done. I don't care about when you're there, when you're not there. If you're doing your work and you're getting it done, and you're a good human being and you work hard, the rest takes care of itself. And I'd love having people work all over the country. I think it's awesome.
That's fair. Well, I'll say that nothing would make me want to untether more in the United States than healthcare. Nevertheless, if you set that aside, that little, put it under the rug, then yeah, plenty of places to see, plenty of places to work from and still be productive. That's fair.
Totally agree.
All right. Now, one of my more favorite segments, decline to comment. So I'm going to ask you 3 questions in order, and you can pick only one of them to decline to comment. Otherwise, you're going to have to pull out the really political way of responding if you got to answer one of these, if you run out of...
Bring it on.
All right, here we go. Number 1. What is the most significant conflict you've had with a boss or peer, and how was it resolved?
All right. I had a boss. Well, I don't get to hear all 3 to see which one. That's
right. The fun in the game.
Oh my goodness. All right. I'll get the rest can't be this hard. So I had a boss who was unethical. And I'm a pretty direct person. And so I had a direct conversation with him, hoping that would do something, and it didn't. And then I had a direct conversation with his boss, hoping that would do something. And it didn't. And so I left. And it was one of the happier days of my early career.
Did you have any kind of confrontation, or did you just kind of, yeah?
No,
that's
I just said
probably
that,
the right way to do it. Yeah.
There's no use in doing it that way.
Won't go
right?
anywhere.
So I just said, I made the decision to go do something else. Where
That's fair.
Going? I don't know. I'm going to go do something else. I was at a point in my life where I could do that, and it was one of the better decisions that I've made. So
sometimes you just got to go. Hey, that resonates. Yeah. All right, great. Next, have you ever had to support a decision you fundamentally disagree with for the sake of your job or the company? And what was the decision, if so?
I'd say, I think at the time I didn't agree with it and went along with it. And then in retrospect, I realized that we didn't have another choice. We had to do, again, this is kind of in the hard decision category. A company that I was at a long time ago, we had to do layoffs. And it was the first time I had dealt with that. And I really didn't believe that we couldn't find another solution. And it was because I was early in my career. I didn't understand sort of, the math in terms of the business and the situation that we were in. And, but I had trust in the CEO, and we had a very honest and frank conversation about it. And I got behind it. And then in retrospect, I realized that he was right. And it was something that, albeit one of the crappier things that you ever have to do, we had to do it. And it was the right decision. And I was on board with it, even though I didn't realize it until, I didn't realize it was the right decision until retrospectively. So.
Definitely. The last year or two, I think a lot of companies have had to deal with something similar, and many folks kind of having had done it for the first time. Hopefully we're nearing the end of the cycle in that regard. But I remember the first time that I had to navigate that challenge, and it's like you try and look for every other alternative, right? Because we're human. We don't want to bring suffering to anybody that we work
exactly.
with, and sometimes there really aren't any. So that's
hard.
That's
hard
that
stuff. One of the worst things you can go through as an HR person and as an employee too. Much worse as an employee, but as an HR person who cares deeply about the people you work with, it's not a fun process to go through.
100%. All right. This third one, you've already answered two, so you can decline or just go for it anyways. Number 3, what is the worst piece of advice you've received in your career?
I think I'll decline. I don't know that I have a good one on that. And since I've got the free chip, I think I'll decline.
Yeah, might as well decline. It's fair enough. But you don't have to think too hard to be creative if you're just like, I don't know. All good. All right. With that, we're moving on to our last segment. Cheers to change. So this time, pushes for greater pay transparency are changing the game and turning CHROs into chief human financial officers. Danielle Moss, head of global total rewards for Ralph Lauren, says you need to go from checking off the box on your people analytics dashboard to making sure it's part of the culture. It's time we celebrate the HR leaders that are investing in better performance measurement tools, as well as better solutions for insurance and benefits, so that they can make better decisions with better data and build more transparent and equitable companies. So with that, Chris Cigarran, it's been great to connect with you. We can do a little cheers. Cheers to change.
Virtual cheers.
Yes.
Let me know if you make it to Nashville.
Excellent. I will. We have somebody on our team there, so maybe he'll come by and say hi. But great to connect with you, Chris. I think what you're doing to Imagine 360 is awesome, and have an awesome rest of your week.
Thanks. You too.
All right. Bye-bye.